My name is Dr. Pottow. So thank you firstly for the invite, Fertility Solutions, so that I can stand here and talk to you about my pink egg. This is a simplistic way of looking at eggs, because I think this is it. The information is just so overwhelming. Wherever you go, wherever you read, you can go deeper and deeper and deeper down that rabbit hole and it gets a little bit overwhelming of, okay, well, what are we trying to achieve here? And so to simplify it, I always talk about a pink egg. Women are born with their eggs. Now that's a big statement. It's being reproven in literature right now about stem cells, and so there's a lot of research out at the moment. But to simplify it, I want you to think of the biggest difference between men and women. Our women are born with their eggs, men make sperm every day. My husband says it has to be a lot more complex than that, and I said it's not. That's what it boils down to. So if we look at the first jar of eggs, that's you in your 20s. Lovely basket of eggs. Next one, your 30s. Next basket, your 40s. So we all know your basket of eggs depletes with age. Nobody will dispute that. We all know that. And that's why falling pregnant gets harder with age. But the most important thing is, can you see in that first jar how many pink eggs there are versus the next versus the next? So I want you in your mind to think of this as a little race and how your ovary works. Your ovary goes, right, your period's about to start. Let me choose. You. Chooses out of that jar. Lines these little eggs up and says, on your marks, get set, go. These little eggs have a race. The egg to get to the finish line is the one that wins the race. So when people say, why didn't this work? Why am I not pregnant? You've checked my tubes, you've checked my uterus, my husband's sperm is fine. It just wasn't the pink egg. As you can see, the period happens and your ovary wipes the slate clean. And it goes again. You. Line these little eggs up. On your marks, get set, go. And they have a little race. So as you can see, this ovary is clever. It's trying to get this basket to last all the way through to menopause. It's not going to be generous and throw out 400 eggs in your first race, because we would deplete the basket. So as the amount gets less and less, so the ovary recruits less every month to run the race. With age, your basket is decreasing, but so is the amount of pink eggs that are available to be recruited. So if you think of it in this way, it's not something you're doing. It's just what's in you. So if we look at diet specifically, it's not about that diet can't have a role. We've just heard how important diet is. I always say to people, you don't want pale pink eggs, you want Barbie pink eggs. So the point is, yes, diet is very, very, very important. But the point is, where it helps somebody is when they're sitting at the end of the basket and they say, I've done everything. I am eating everything perfectly. I have done every add-on that you've just heard of. How come this isn't working? It's not that it's not working. It's just maybe we're at the end of the basket where there isn't a pink egg available. So when you think of it in this way, this helps with the journey. When people say, do something different, we've just heard that. No, don't. We're going to get the basket to recruit a whole bunch of new eggs. We're going to have the eggs saying, on your marks, get set, go. If we're doing IVF, what are we doing? We're standing behind those eggs going, come, pushing them all to the finish line so we can pick them all up. So statistically, mathematically, we've got an increased chance of finding the pink egg. It's not something that you can do to give yourself a pink egg. If your friend's trying to conceive and she falls pregnant this month and you fall pregnant 3 months later, she's not more fertile than you. She was lucky in the month that she was choosing to fall pregnant. Her little pink egg won the race. Doesn't mean you don't have a pink egg. We don't like seeing this, because this is brilliant, the 20. In that category, age 20, we're being told as women, find the right partner, become educated, don't settle. Are you financially stable? And the answer is no, no, no. So we move into the next basket. And this is what happens. And ironically, when we're probably most ready, emotionally secure, financially secure, and have chosen the right person to do this with, even if it's on your own, you're sort of sitting in this basket. And that's the difficulty. So if you understand there's nothing wrong with you, it's important, you are what you eat. Make sure that you are following all the recommendations so that we've got a Barbie pink egg when it pops out. But to eliminate the choice of trying to choose different things, no, 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 that person said I must eat this, I must stand on one leg, I must meditate, I must stand on my head. This journey is just about finding your pink egg. So have the perseverance. Why not me? My pink egg's there, it's going to come. It just might not be in that month that you've done the treatment. But don't give up, because your ovary will recruit, you will have a new little race, and the pink egg might be in that one that you find. So this is more of a simplistic way of looking and more a graphic representation. And ironically, it was a vet who was a patient of mine who, whenever I'm talking about egg quality, I found patients always want to blame themselves and say there must be something I can do to improve my egg quality. We can show graphs and say it's going to decrease with age, but people say, no, 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 but I know a 45-year-old who is pregnant. And so it was more a way of taking that stress off yourself as an individual to say, no, I'm born with this basket of eggs. Am I age appropriate? Are my expectations correct? Am I being unfair on myself if I'm trying to find that pink egg when I'm 41? Which basket are we digging out of? And I think if that helps you stay on the journey, it helps you get to that next phase of, okay, I know I've checked everything, it just wasn't the pink egg. So you go again, and that's the journey, and that's where the grit comes from. I can't tell you the amount of patients that send me pictures in pink outfits with their pregnant tummy saying, I found the pink egg. And if that's what helped them get through the journey, if that's what helped them get there, then this little analogy to take the blame off yourself, this is not something you shouldn't or shouldn't be doing, this is what you've got. And an interesting topic, I went to an international meeting and another doctor was standing up there and he had a picture of sweets and I had such a laugh because I thought, oh, that's how I explain it, just to try and make it a little bit easier to understand and to take the guilt off, that it's not you, there's stuff you can do, but besides that, wait for your pink egg, it's coming. And that's my story of the simple pink egg.